Hey, Shark fans, it's Melinda with another episode of Heard It on the Shark. And today in the studio with me, I have Dr. Wanda Stroupe, who is the nurse practitioner and owner of Family Care Clinic in Ripley, Mississippi. Wanda, thanks so much for coming into the studio to talk with us today.
It is my pleasure. Thank you so much for having me.
We are going to talk today about COVID vaccines. So I'll just let you talk and tell all the things that you want our Shark listeners to know.
Okay. Well, first of all, the most important thing I think for everyone to know is that we strongly recommend the vaccines. There's been a lot of fear, a lot of concerns, both from healthcare professionals and healthcare workers, as well as from the general public about this vaccine. But like all vaccines, there are risk factors, and like all vaccines, there are great benefits. In the pandemic we find ourselves in right now, I think we need to seriously consider the importance of this vaccine and the importance of protecting ourselves and our families. So right now, I think that's a big important thing for us to consider is how valuable this vaccine is to us as a country and as a nation. I think that a lot of concerns are going into the rapidness with which we've seen this vaccine develop. But as we look at other vaccines, we see that from time to time anyway. We had H1N1 a number of years ago, and we had a fairly rapid development of that vaccine, and it was given to our children. This one is not given to the young people. It's given not below 16 years of age, and some of them are 18 and above. But I just feel like we need to get past that fear and recognize that there's so much value in this vaccine.
Tell me who is able to be vaccinated right now.
Well, right now we're in the phase that includes the first-line healthcare workers, and most of those have been offered the vaccine, and a good portion of those have taken it. We'll be looking at the next phase and the next tier. We're already into that, which also includes the healthcare workers that are not considered first-line. Also, our police departments and our first-line first responders and those kinds of people will be considered in this. Postal workers, things like that are considered essential workers are actually this phase of our vaccines have been implemented right now.
Okay, so let's say that you're in a group that's able to get vaccinated. Are you able to get it if you're over 75 right now?
Just this week, we're starting 75 and over. That's being implemented. We spoke to the Mississippi Department of Health. The federal government obviously sends out these vaccines, but each state is allowed to have their own way of distributing the vaccines. Right now, all the vaccines are going to the health department for those people 75 and over. No individual clinics are getting them at this time. Most all of us have signed up. I know we have, and have the paperwork submitted to be able to give the vaccine at our clinic. But right now, as of this morning, the Mississippi Department of Health said that they are right now sending them all to the health departments, and they're not sure when they'll be able to send them out to individual clinics at this point.
So if you're over 75 and you want to go ahead and get the vaccine as soon as possible, you should call your local health department.
Yes, you should. And there's a way to also go online where you can register and find out what local health departments are offering them. I know Lee County has it. Lafayette County has it. As of about 4 days ago, that was the closest to our area that I had seen that you could register to get it. Hopefully, we'll see some closer to Ripley, but at this point in time, that's not the case. But you still can get registered to get it.
Okay, Dr. Stroupe, the line to get a vaccine seems to be pretty long. I know that my parents have called and been told that all the availability was gone for the month of January. So tell us about availability in the near future.
Well, we hope that that's going to be much improved. I know that they're committed to opening up more slots, and they only give so many any day. But what we're hoping that they will be able to distribute it out to more sites, and by doing more sites, that would allow us obviously to give a lot more vaccines. They are doing the drive-through vaccination clinics now, and so that's available as well as going online to register. One thing, though, that people need to remember is if you can afford to drive or have transportation to get to other areas, you can get it outside of your area. You could go to Tupelo or to Lafayette County or to one of the ones that do have some slots available. So that's worth looking into.
All right, so let's say that you get signed up and you get your vaccination. Tell us about the two-partness of it. If you get the first part of your vaccination and don't go back, what are the odds that the vaccine is going to help you?
Well, I think you'll have some benefit regardless. It takes about anywhere from 2 to 5 days to start developing the antibodies once you've gotten the vaccine. The second part of the vaccine kind of helps solidify that, and so the very first part helps the cells in your body start to develop antibodies and start to protect you. the second part of that actually helps those cells to identify the vaccine more so. So you do need that second part of the vaccine. It is very important for you to get full coverage from the vaccine. And since there's so many schools of thought out there as to how long this vaccine is actually going to benefit us once we get it, then we need to try to get the best benefit by going and getting that second vaccine. So I think that's really important. I've had my first part already and we'll be getting my second part in about 2 weeks. So I think it's really important that we understand getting that second half of the vaccine.
And once people are vaccinated, are they then free to go out and do as they please?
Well, no, unfortunately not. We wish and we hope to get there soon, but you still need to wear your mask. You still need to social distance. You still need to be careful. You are going to have, obviously, the antibodies, but since we still have a lot of unknowns about how long that will last and different types of transmission, and now there's the second strand of COVID that we're seeing across the country in some places, we still want people to take those precautions because we don't know all there is to know about this virus yet.
Are medical professionals recommending that people who have had COVID, say 2 or 3 months ago, or even 6 months ago, get the vaccine?
Yes, we are recommending if you've had COVID to get the vaccine. There are people who've had the monoclonal antibody, which is a new IV. I won't say absolutely new, but it's one of the IV medicines that's more available to us now. In the last 3 weeks, we've had the availability of that, and that has helped tremendously with the people battling this illness. But those are the ones that we say can wait about 90 days to get it because we don't recommend it right away. But for those people who did not get that IV monoclonal antibody, then we do recommend you go ahead and get it even if you've had COVID.
What about the flu vaccine? Can you take both at the same time? What are you recommending with that?
Well, we're recommending that you get the flu vaccine at the same time you normally would get it, which most of that is past at this point. We feel like that they'll be given together next season if we have to have a second COVID vaccine, which we don't really know yet. But to my knowledge, there has not been any recommendations to separate the two, with just understanding that both of them can cause some fatigue and both of them can cause some soreness in your arm and some side effects with low-grade fever, like any vaccine we give. So that's something to talk to each individual healthcare provider. I would say that there might be certain patients that were high risk that we might consider a separation of those, but that need to be individualized to the patient and to their provider.
Let's talk about what we should do in the meantime, regardless of if we get the vaccine, if we don't get the vaccine. What are, in your estimation, seeing all the people that come through your office, what are the most important things that we do to stay safe?
Really wear your mask properly. So many people either don't wear their mask or when they wear it, they don't wear it properly. If you're going to be around people who you're going to expose or who are going to be exposing you, then if you're going to wear a mask, wear it properly. There's really not much point in having that without it. Washing your hands, the same things we've had from the very beginning. Social distancing when you can, there's times when you cannot. So that's important to remember. And just wash your hands and take the same precautions that we've been kind of preaching from the beginning of this. And just be smart. Watch yourself for symptoms and watch those people in your family or close to you that are high risk so that you don't put them at greater danger. Because there are people out there who are asymptomatic that don't show any symptoms and they can pass it. So you have to be really careful about that. So really and truly the washing your hands and social distancing when you can.
Regardless of how careful we are, I know that a lot of our Shark listeners either have COVID right now or will get it in the future, maybe are still battling it, have a relative that's battling it. What have you noticed are some of the things that you can do to shorten the virus or make it not become extreme?
Well, the main thing is getting tested as soon as you think you may have it. Come to the doctor for your checkups. We've had so many people during this time that have completely ignored their wellness exams and regular checkups and things that put you at risk. High blood pressure puts you at risk. Diabetes puts you at risk. And those are things that most people deal with every day and they don't really worry about it because they have it under control. But when you look at COVID and you have someone with high blood pressure or diabetes, then their risk factors are much stronger and much greater than those people who have no healthcare problems problems at all. So one thing to shorten, I guess, is rest. Once you first get early diagnosis as soon as possible so that we can determine if you need the monoclonal antibody. And that really is anyone over the age of 65, anyone who has any high blood pressure or diabetes. Obesity falls into that. So your healthcare provider needs to work with you closely to decide if that is an option for you. We've had really great luck with it, been able to give it locally at our local hospital at Tippah County, and they've really stepped up. But during this time, we've had so many patients that we've had to transport by ambulance, and the hospital has done a great job. The ambulance service here in Tippah County has done a fantastic job with transporting our patients where they need to go. And those people have worked so hard, and I think we've been very blessed locally to have the support that we have from the hospital and from the ambulance service here. So getting early diagnosis and getting early treatment so we can help decide what's the best route for you to go. And then following up like you need to, because rest is so very important. I have so many patients that I have to really, really stress that pushing yourself during this time is not the thing to do, that you got to sit back, and it's going to take anywhere from 4 to 12 weeks for the fatigue to go away, even if you recuperate well. And most of us are high energy people. We want to be on the go. We want to do our thing. And it's been really, really hard for people to grasp that you need to rest.
Okay. Thank you so much for helping us to understand better what we can do to get the vaccine and what we should do if we find out that we have COVID. It's really important for us to stay in touch with our medical professionals right now, I think.
Absolutely, I agree.
This is Dr. Wanda Stroupe, the nurse practitioner and owner of Family Care Clinic in Ripley, Mississippi. Thank you again for coming in and taking your valuable time.
My pleasure. Thank you for having me.
Shark fans, you guys stay safe and have a great rest of the day.
This program was pre-recorded at Sun Bear Studio.